Welcome to Snooze Worthy, a podcast by Parenting Practice of Colorado, your window into the world of pediatric sleep, where we explore the science behind sweet dreams, effective sleep teaching techniques, and all the intriguing nuances of your child's slumber. I'm your host, Lindsay Birchfield.
And I'm Paige Legault. Together, we're here to guide you through the labyrinth of parenting, offering insights, strategies, and science-backed advice to make parenting during those early childhood years not just manageable, but truly memorable.
As pediatric sleep specialists, we've seen the transformational power of sleep in countless families.
And because parenting is a journey, we won't stop at sleep. We'll provide you with valuable parenting tips for every aspect of early childhood, from managing tantrums to fostering creativity and hitting those all-important milestones.
So whether you're a seasoned parent in need of a sleep overhaul or a new parent preparing for the joys and challenges of early childhood, Snooze Worthy is your trusted resource. Join us as we unravel the science of sleep, share practical advice, and make parenting truly snooze-worthy. Hi, and welcome to Snooze Worthy. My name is Lindsay Birchfield, and I'm here with my co-host, Paige Legault. And today we are absolutely so excited to announce that we're going to have a couple of special guests with us. So first, we're going to have Constance Lewis, which is one of our wonderful team members that you've met on a past episode here. And she has brought along one of her past clients that has experienced something that is really probably more common than you would think, but something that we as a society really believe that women and especially mamas need to be aware of. And so just before we do jump into this, I want to say that today's story is something that's a little bit heavy. It could be something that could trigger some feelings within you. And it is a serious, heavy story with a wonderful outcome. But we want you to be aware that this story could impact you. And so just be aware as we dive into our wonderful guest story that is a possibility. And so today we are going to be talking about postpartum psychosis. So in our past episodes, Constance has shared some information just about postpartum depression and anxiety, and then going kind of that next step to postpartum psychosis. And so I'm going to throw it over to Constance first to just give us a rundown of what is postpartum psychosis. And then our wonderful guest, Gabby Girdwood, is going to share her story of going through postpartum psychosis. And so with that being said, Constance, do you mind just kind of laying a foundation for our listeners to truly understand what is postpartum psychosis?
Absolutely. And thanks for joining us. This is a very important topic that I'm excited that we're going over today because it's not talked about a lot. I know we're starting to really talk more about postpartum anxiety and depression, which is good, but not as much about postpartum psychosis. So this is here to help bring a lot of awareness to this. And so it's very important to talk about. So postpartum psychosis is a more severe mental health condition that can affect people after they give birth. It's rare, but it does happen. So rare meaning it's more rare than postpartum anxiety and depression. Postpartum psychosis is anywhere 0.26 to 0.66 out of 1,000 women may experience it. So again, and the lower percentage is 2-4%. But people who experience postpartum psychosis do have a higher risk of more significant medical challenges. And it can affect really anyone, honestly. And it usually can occur several days after birth, but it can even occur up to weeks or months. And as you will hear from Gabby's story, that it didn't happen right away for her as well. So, that's a confirming. So it's higher in women who have certain mental health conditions, but not necessarily as well. Some people who don't have any previous history of mental health conditions can experience postpartum psychosis. And we don't really know the exact cause of it. We know that there's some contributing factors in it, but we don't know the exact cause. And some symptoms, and Gabby will go over her symptoms and what happened to her, but hallucinations, delusions, mood changes, disorganizing thinking or behavior, depersonalization, which means just kind of out-of-body experience, insomnia, so an inability to sleep, irritation, thoughts of self-harm or harming others, depression, manic. So there's just a lot of symptoms that can go along with it. And everybody's story is so different and individualized. So we're just really thankful that Gabby has been brave enough to join us today and talk about her story, and she will tell you why she's here and what is important to being here to her. So thanks for coming on and being with us, Gabby.
Yes, hi. Thank you for having me. And so I just wanted to come on and talk about postpartum psychosis because when I was experiencing it, I didn't have anyone to relate to because I'd never really known anything about it. So I hope that this reaches people that it can help, even if you don't have postpartum psychosis, even having postpartum anxiety, depression, this may help them as well, because coming out of it and going into psychosis, it started off more anxious feelings and things like that. So I just want to be able to share and hopefully help some people, because I definitely would have appreciated someone like me hearing their stories.
Yeah. Thank you for being here.
Of course.
So how did your journey start?
It's so I had my daughter, my first child, August 28th of 2022, and everything kind of seemed normal. I became a mother, so it was a pretty significant change from what I was used to. Me and my husband decided to have a child. She was planned, and it was overall just wonderful, but it was also really hard. I personally am someone who really appreciates control and a schedule and things kind of going a certain way so that I feel like comfortable, if that makes sense. And so when Quinley came, it was like a whirlwind. Everything was confusing. I didn't know what to expect. When was I going to sleep again? When was I going to take a shower? And I felt like very overwhelmed. But I was told that this was all normal, and things will level out and everything will be fine. So I think I kind of held on to that. But as the weeks went on, it was week 3. We had a huge hurricane hit. I live in the Punta Gorda area, and there was a huge hurricane, Hurricane Ian, devastated Northport, Port Charlotte, Sarasota, all that area. And we were out of power for about 10 days. And I had a 3.5-week-old as a new mother. It was a lot. Yeah.
Yeah. And as Gabby attests, and same with me, and why I think that a lot of women who are significantly type A personalities, or just very used to schedules and having control over our schedule, and having things go a certain way, like we feel comfortability in that. And Gabby's a nurse as well as me, and nurse, not that type B personalities can't be nurses, but we thrive on that control. Like, we have a schedule, and we give our patients medicine at this time, and we do this at this time, and we do this at this time. So that translates to our life. And so we tend to see women who have that lead more with postpartum anxiety and depression. So.
Yeah. Very, very true for me. And also, I waited till I was 30 to have my first child. You live your whole life as a single, just me and my husband. We had been together for about 7 years before even deciding to have children. Just, everything's the same for so long. And then all of a sudden, boom, there's a child, and you're like, what happened? So, yeah. So yeah, it was 10 days of no electricity, and I was getting really anxious. I was seeing a lactation consultant because I was breastfeeding, and that whole thing was just stressing me out. Was she getting enough? And then when the hurricane hit, I'm like, how am I going to get her help if she needs help? And then it was like a spiral, like, oh my gosh, she's going to get sick. And then we're not going to be able to get somewhere. We're not going to have enough gas to go to the hospital. It's just all of these thoughts that as a mom, you're just like, how am I going to take care of my newborn child? And it was just from then on, it was just a spiral. And then I thought that she was ill. I would take pictures of her and send her to my husband and say, does she look jaundiced? He's like, no, she looks fine. I'm like, and I wouldn't believe what he said. And there's just things that kind of happened. It's just like a lot of racing thoughts. I would stay up late at night, just going through so many thoughts, like, and I couldn't sleep, insomnia, and almost, I'd go to sleep and I'd wake up in like 20 minutes and be like, oh, I forgot something, or oh my goodness, something else is going on. Like one thing to the next. It was just, I wasn't getting enough sleep. I wasn't taking care of myself.
So what would you say, looking back now that you've been through this, and we're going to talk more about your story, but what were the signs that you want other women to know that this started to spiral, that you didn't notice at first? Maybe like you just said, insomnia, like I wasn't getting enough sleep, right? The racing thoughts, the not taking care of myself. So looking back on it, if you were going to educate a mom in a quick few minutes and words, like what would you say? Like, if this happens to you, do this. Or
that's hard.
It is.
I have thought about this a lot because it's so important. Looking back, so I'm newly postpartum right now. I have a 6-week-old, and
congratulations.
And we've been paying very close attention to everything, just in case, because it is severe. Has a it's related to infanticide and suicide. So obviously I don't want to harm my children. I don't want to harm myself. So I was very, very closely monitored. So I've been looking for anxious behavior, like over worrying, and then not being able to stop worrying. So if something is on my mind and I can't get it off my mind, and then I go through like a thought that is, continuous, like, oh, something's going to happen to my child, and then it's just like a cycle and I can't get it out of my head, that would be like an alarming thing, just to tell my psychiatrist, hey, I'm having these thoughts, I can't get them to stop, and it's keeping me from sleeping. So we've been paying attention. Am I sleeping? She said I need at least 4 or 5 hours of sleep in a stretch. So we've been paying attention to my sleep. Also, irritability. I know that sounds weird, because as a new mom and you have another toddler, you're going to be a little more irritable, but even just mood that is like doomsday, like you're irritable and it's never going to get better, and it's like a continuous thought process where you're like, I'm the worst mom. I just negative thoughts, intrusive thoughts. This day is not going to, it's never going to get better. I don't know. It's so hard to explain.
Yeah, no, you're explaining it so well. I think that the difference between a new mom and having the baby blues or slight anxiety versus like this is getting out of control is the fact that are you allowed to stop the thought in the moment, right? Okay, yeah, you're going to have some worry and some stress and some anxiety about your baby breathing while they're sleeping or dying, or, everybody has those, right? And everybody thinks I'm a bad mom. Everybody has said that to themselves who's a mom. Yeah. Everybody, right?
Plenty of times, yeah.
Plenty of times. But when it gets to the point where it's cycling so much where where reality is not reality anymore, I think is a great thing to tell people to look out for. So yeah, that's great. So tell us a little bit about how it really kind of started feeling out of body for you. Like it was like, you didn't feel like you anymore, and that spiraled.
So, oh man. Okay. So I woke up in the middle of the night, one of the nights, and I felt like I was crawling out of my own skin. Like I needed to get up, I needed to move. And at this point, now I know that was like mania, where I needed to like leave. Can you guys hear me? Because I can't hear you guys right now. Okay.
Oh yeah, you're breaking up a little bit, but we can hear you.
Okay. So I was rushing around my house at 3 a.m. and I told my husband, I need to get out of this house. At this point, we still hadn't had any electricity. So I'm rushing around. He's like, well, where are you going to go? I'm like, I'm going to go to my dad's house, which is very strange because I don't go to my dad's house. He's wonderful. We have a great relationship, but I would go to my mom's house, but I didn't want to go to my mom's house. So I went straight to my dad's house, which he lives 3 hours away in the middle of the night. And I took my child with me. Yeah, it was, and I packed like random stuff. You know, you have a newborn, you would think you'd be more organized. Like me personally, I have like a checklist of things I need to do. And I was just throwing things in the bag, like completely disorganized. But I still had some reality. Like I knew I was going to my dad's. I knew that I had a daughter, I had a husband. These are all normal things. But the whole packing and being like manic was just the beginning. And then I drove really far to my dad's house with my newborn in the car. Praise God, I made it there. My dad was like, he didn't even know what to do. He doesn't know me well enough to know that like things were just out of control. And so I got there, I started panicking that I wasn't making enough breast milk. They bought formula. I thought the formula was gonna poison my child. So that's kind of when it started getting, kind of crossing the boundary of being realistic to unrealistic. And then in the middle of the night when I was there, I was sure that she was feeling ill. Opened up the Tylenol bottle and I was going to give her Tylenol, but I ended up not. I've decided not to. And I took like a 30-minute nap and I woke up and I forgot I had opened the Tylenol and I'm like, oh my gosh, I gave my baby so much Tylenol. Then the next morning I was so certain that she was jaundiced, that I had poisoned my child with Tylenol and that she was now jaundiced. And like jaundice is, I don't know if anyone out there knows, jaundice is a condition where your liver gets injured by something and you start producing bilirubin, which turns your body yellow. So I thought she was yellow, which she was not. She was healthy and thriving. And then at that point, it was like midday the next morning. And I was like, I need to leave. I need to go home. I need to be with my family. Like, I just felt like nothing was right. And I need to make it to somewhere where it felt right. And it was, now looking back, it wasn't anything that was wrong except for me. So I was driving back home another 2.5 hours during the day. So that was a little better with my 3-week-old. And I started panicking that she was dying in the back seat, that she was dead in the back seat. I was at this point like asking God, why would you take my 3-week-old away from me after, I waited so long to have her, and just all these things. And I called my husband in a panic and told him I can't drive anymore. I need him to come pick me up at some random, I pulled off one of the exits and I think I parked at like a Bell's. And I went inside and walked around and she was not dead, thank God. And I walked around and at this point I thought that everyone was looking at me. I felt like if she started crying, I felt like people were coming towards me. Like I was getting very, very paranoid. And finally my husband showed up at this random Bell's and he was like, what is wrong? And I'm like, I need you to take her. I need to just drive by myself. I don't think she's safe. He looks at her and he's like, she looks healthy. Everything's fine. When's the last time you fed her? I'm like, I don't know. And he's like, what do you mean you don't know? I'm like, I don't know. And we got home. And he had to work, and I think he was like, do you think you're well enough that I can see the rest of my patients? Because he is a chiropractor and he left his job so he could grab me and there's like still patients waiting. So I was like, yeah, I'm fine. Not fine. And I don't even know exactly what happened. I think I texted my Bible study teacher at this point and I said that my neighbor was out to get me. So obviously I've crossed over to delusions, losing track of reality, complete paranoia, which my neighbor and I are very close. Like she's one of my best friends, and my Bible study, we both go to the same Bible study. So my Bible study teacher was like, okay. And she's like, I'll be right over. She knew something was wrong. And so she brought me Chick-fil-A because I'm 3 weeks postpartum and she's a loving, caring person. And she brought me Chick-fil-A and I took a bite in front of her and I literally looked at her and I was like, why would you poison me? And I spit it out in front of her and I said, you need to leave my house. At this point, she had called my husband and said, you need to come home. She's not okay. And he got there, she never left, and I was just staring at her like had all these thoughts like she's gonna hurt me, she's gonna hurt my child, I need to keep her away from me, which is absolutely insane because she is so wonderful. And that's just like makes the story more believable because it's like she was fine, everyone was fine, it was just me. And so I convinced my husband that if Quinley wasn't ill, then something is wrong with me. And so he called his friend who is a doctor, an OB, and she got on the phone with me and was asking me questions. I don't remember what. And she got off the phone with me, talked to my husband, and said, "This is beyond postpartum depression. She needs to go to the hospital right now." And because he was like, maybe she just needs a
nap.
Yeah.
Or some Celexa, an antidepressant.
Yeah.
She just needs a little antidepressant.
Prozac.
Yeah.
I mean, I don't know what I would think if he went like on that side of reality. Like, I don't know if I like, can you stop? Don't do that. What are you talking about? No, you don't really experience people in that state of mind.
Mm-hmm.
So we ended up driving to the hospital with my 3-week-old, and I remember thinking multiple times that my husband was trying to take me and hurt me. So I thought multiple times, I'm going to grab the steering wheel and drive off the road. But I never did. But those thoughts went through my head. Mm-hmm. And that's the scary part. That's why, the suicide rate and the infanticide rate is a thing, because you do have those really scary thoughts. Thankfully, I didn't act on them. We made it to the ER and they didn't know what was going on. They were like, "Why are you here?" And of course, he's like, "My wife is having some sort of something." And so they have to interview him and I, make sure Quinley's at this point, she's screaming. She's probably starving. Because mom doesn't know the last time she fed her.
Yeah. I'm going to pause you there just for a second because I want to point out to everybody what you're saying about going to the emergency room or seeking care from healthcare professionals because, you were advised to, which is great. I'm glad that OBGYN friend told him to take you to the hospital. That was like the best thing. But even when Gabby got to the hospital and, there's a whole story behind this that, that she'll probably not share the whole thing. But they didn't know what to do. They didn't know what to do. They didn't know. They thought that her husband was abusing her, it was a whole situation that went down a rabbit hole of how they treated her and her husband and separated them because they didn't know what to do. And so that's why she is here today, is to educate people, and hopefully healthcare providers will listen to this as well and be aware that that this is a condition that is out of her control, and that it's, that we need to not treat people as in a way necessarily of this woman is crazy or her husband's abusing her. Right. So that's another part of the story that she'll tell. That's just crazy.
Yeah. So we made it to the ER and they immediately separated us because I was visibly upset. I was acting like I didn't trust my husband. My daughter is crying, screaming at the top of her lungs. And they're like trying to get down to the bottom of it. They asked me what was wrong with me, what was my symptoms. And I'm like, no, it's my daughter. Something's wrong with her. And so I don't know exactly what my husband had said to them, but they ended up taking me back to the ER. They stayed back and they interviewed him. I don't know exactly what they asked him, but then I never saw them again for 8 days. Well, besides visitation, which is a whole thing. So I got put into the ER and then my thoughts just started just getting worse and worse and worse. It was just, as soon as they were gone, it was just, I had nothing to grip onto. No one I knew. So I didn't know the doctors, the nurses, what was going on. So I couldn't grasp onto any part of reality. So it was like that, this is now the disassociation. I became completely disassociated with myself, with the situation. And I kind of turned into like a hermit crab. They started asking me questions and I just was having internal dialogue that I could only get out like yes or no questions. They asked me if I was suicidal, and I don't even know if I answered it. And so they immediately Baker acted me, which at this point I was not suicidal at this point. I wasn't wanting to harm myself. I just was so very confused with reality.
Mm-hmm.
And then, so with what happened to my husband, now obviously I know what happened. He got interviewed. They asked him no questions about how I was, but they ended up calling DCF and having them investigate us and our whole family. And I understand as a healthcare provider just to be safe, but if there was awareness around postpartum psychosis, I think they could have seen it, because I'm 3 weeks postpartum. I'm disheveled. My child is screaming. I'm disorganized. Now I'm almost catatonic, not speaking.
Yep.
There's like all these like, hey, no one even assumed that was what was happening until I had a psychiatrist evaluate me after I was already in a psychiatry. I went to a psych hospital. It's called Bayside. I don't know if I'm supposed to say the names.
It's okay. Yeah, we'll take it out.
They missed all these red flags.
Obvious.
Yeah.
Obvious red flags.
It is obvious for, I think, for professionals like you.
Yeah.
It should be obvious to ER.
It should be. That's the hard part and the sad part about our healthcare system right now. I don't even know how to explain the rest of
go.
Yeah, it's
yeah. I'll help you with that. So she was in the facility, and a lot of crazy things happened at the facility in itself, but that's probably like a whole nother story, because that's just, a part of the psychiatric side of the world that people aren't aware of. But let's talk about when you were coming home, once you kind of at the end of that, when your husband was like, I'm going in and I'm bringing her home because so again, with postpartum psychosis, you lose reality, right? So as Gabby described, is once you took the people away that she knew and loved, even though she still thought that her husband was trying to kill her, right? At a point, right? But she still knew them. So she's in a facility. She doesn't know anybody. She's not comfortable she doesn't know anything. It's not her home. It's not her husband, like all these things, right? So then you get even more disassociated. And so at one point her husband came in and he's like, I'm bringing her home. I'm taking her home. I promise I will watch her. We have a psychiatrist on, all the stuff, right? He's doing all the right things, which thank goodness. And he's somewhat healthcare, right? Because can you imagine if he wasn't?
Right.
So he brought you home. So tell us about that.
Yeah. I'm just going to rewind a little bit just to, during my stay at the facility, he had multiple times and advocated for me to come home sooner, and said that he knew that I was getting worse and worse. And I was getting way, way worse. I was going down a rabbit hole. I ended up having suicidal ideations. Not that, I don't know, never understood suicide. Obviously, I'm like, how could people leave their families? How could they leave their lives? And when I had these thoughts, it wasn't that I wanted to die. It was that everyone around me wanted me dead, and that this is how it was going to go down. And I would have visions of how to get it done. And that sounds absolutely terrifying, but I think people need to know that I didn't want to die. I really didn't want to die. I felt like I had to die.
Mm-hmm.
And that's horrible.
Yeah. You told me that you felt like people thought if I died, they would be better off without you. That's where the suicide thoughts came from.
Right. Yeah. And that everyone would be happier, because during like one of the delusions, which it might trigger some people, but I thought that I had murdered my child, like actively planned and plotted a murder with my husband. So like these delusions just kept trickling. And so that obviously if you feel like you killed your child, you probably wouldn't want to live, and you wouldn't want, people wouldn't be rooting for you to be, living if you're, I don't know, that sounds horrible. But
truth.
I think the guilt of thinking that I murdered my child made me feel like no one's going to want me alive. Like, why would anyone want me here? So anyway, moving forward, they finally agreed to discharging me, even though I still wasn't in my right mind. And they knew that. But we had to set up a psych appointment. I had to have a counselor. I had to have like a backup plan so that that I wouldn't come back there, which is a good system. But he had to threaten like legal, like he had to go like the whole 9 yards to get me out of there. And I got out of there. On my way home, I was certain I was breaking out of the place. Like he was breaking me free from this place that was keeping me captive, and which is kind of what happened. But I thought that like I was getting away. Like when they were taking me downstairs, I was like, oh my goodness, I'm getting away with leaving. So still not well. And he was like, do you want to go home or do you want me to take you to get some food? Because I hadn't eaten. I had lost like 25 pounds. I refused food while I was there because I thought everyone was poisoning me. That became like a big thing. So Corey would advocate, hey, these are her favorite foods. I remember them showing up and being like, I used to like this. I don't know who I am anymore. So this looks familiar, but I'm not going to eat it. So he took me to Arby's because it's like our favorite fast food stop when we go on road trips and stuff. And he got me like an Arby's wrap and I ate it all. So I was feeling more like I could trust him. On the way home, my counselor that I had never met or heard from before, she said that she wanted to have a phone conversation with me before she took me on as a client because she wasn't sure that I was ready for counseling, and she wanted to make sure I wasn't suicidal and all of that, because that's kind of like a crisis counselor. She's not that. So she talked to me and she agreed to seeing me, thank God, because she was the reason why my whole brain kind of started rewiring. We went to my in-laws. We picked up my daughter. I saw that she was well. I saw that my husband was well. And it was like the pieces just started coming together. I still felt super manic, but it was almost like reality kind of came at me and I agreed to it. So it was like a choice. And eventually, like I just started I kept asking, like, it's hard to explain, but it was like I lost myself completely and I had to start from square one. I had to keep asking, keep asking my husband, do I like this food? Is this normal for me? And am I speaking normal? Am I talking normal? And am I walking normal? Because he said I started walking with my hands down by my side and I wouldn't walk, like I would look unnatural. My voice didn't even sound the same. I couldn't sing for a long time. I know this all sounds so strange, but food tastes brand new to me. Everything I ate was so different. Like it felt like I was starting over.
Everything about yourself.
It was insane. And then my counselor, I saw her intensively twice a week for I don't even know how long, like months and months. And we started doing trauma EMDR. I don't know what it stands for, but it's like some sort of. Do you know what that one is? EMDR therapy for traumatic. Became super traumatic. You murdered your children, and all these things. It's traumatic. You actually believe those things. So I went through that, and eventually I started acting normal. But for so long, I wasn't even able to have a conversation because my thoughts were still so disorganized. And it's a blessing right now to even have this conversation with you guys and like be able to be,
Here.
Yeah, it really is. It's a huge blessing.
You're doing amazing, and your resilience and your support system. We talk about that a lot at Parenting Practice because, I mean, obviously we do a lot of sleep training babies, and you can't do it on your own. I mean, you can, but
you can't. Yeah.
it's difficult. So the support system is key, right?
Yeah.
And so you went through a lot and you're here to talk about it, and you have your second baby, and we want to know how that's going.
Yeah.
Oh my goodness. It's been so wonderful. I'm going to get emotional because, when you go through something like that and you've always pictured yourself with more than one child, it became a fear for me to have another. And we weren't trying with my son now, my 6-week-old. We weren't trying because I didn't feel like I was truly ready. And he he just happened. I mean, I know that's silly because obviously there was components that made him come here, but we were not actively trying. We were actually preventing. So, apparently God said, I am ready. And I truly believe that. And he's here, and it's been such a wonderful experience. I had an amazing birth, and he's been a wonderful baby. My daughter's been really transitioning well. She had some hiccups, of course, because she's 2.
Yeah.
But she's
Yeah,
been really cool. She finally likes my
Yay.
Yay. Woo.
That is normal, by the
Yeah.
way.
Very.
It
Yeah.
happens to all of us.
Yeah, acknowledges that he's her brother, which is a big step because before he was just a baby and he wasn't here to stay.
Mhm.
We're happy about that.
Gabby, we're sorry to interrupt you, but were
No.
there steps you took during pregnancy
Mhm.
to prepare yourself for baby number 2 to either be preventative or more supportive once he arrived?
Yes. So when I came out of the hospital the first time, the psych facility, I was assigned a psychiatrist that my husband chose, and who wasn't very familiar with psychosis. He's a wonderful psychiatrist, but he put me on a medicine that was just it made me feel horrible. So, and I kept telling him I felt horrible, and he said that that was still the psychosis, and I was certain it wasn't because I'm a nurse and I was starting to come to. And I just said, I'm going to find another psychiatrist. So I found a postpartum prenatal psychiatrist. She does all of it, and she took me off this medicine, put me on a different one, and I started feeling way better immediately. Like
Look
as soon
at
as I
that.
stopped taking that medicine, within 2 weeks, I was feeling better. Because I was having a side effect where I needed to be moving all the time. I think it's called akinesia, and it was horrible. And he said that was just mania. And I was like, maybe, but maybe not. And so this time around, I've been seeing her, and more frequently pre-birth. So 2 months before he arrived, I saw her 4 times just to check in. She would talk to my husband, she would talk to me, go over warning signs again, check in with how I'm feeling, because postpartum with my first onto the second, I stayed on still a mood stabilizer, because she said that if I was on a mood stabilizer, that if I were to go into psychosis again or even mania, that having a baseline medicine in my system, then just doing a conjunctive medicine, like adding on to it, would be way easier than starting from scratch. Because the medicine that I'm on, you have to start in slow increments to get to the level that I'm at, which is still very small level. But so I stayed on this medicine from when I started seeing her till now, which has been a big help, I think, with just keeping everything it's a mood stabilizer, so level-headed, I guess. And then I see my counselor once a week postpartum. So I've seen her every week since he was born, and she's a godsend. So I'm super happy with her in my life still. We're not doing in-depth therapy now. We're just kind of chatting about things I'm experiencing as a mom of 2. And obviously she checks in with the symptoms of, how I'm sleeping. How is my thought process going? Am I having intrusive thoughts? Let's talk about that, all of that, but nothing, like it was. And it's been a really, really wonderful experience. My happy and healthy and thriving, and so is my daughter. So I really have nothing to complain about.
Well, what a beautiful story of redemption and a beautiful testimony. And so, with the information that you have shared, there is just a stigma out there regarding postpartum depression, postpartum anxiety. And because of that, women feel embarrassed or they don't want to share what's going on. So, what are your thoughts on that? Any kind of information or tips or tricks, or just thoughts on kind of breaking that stigma and what we can do as just active members of society, or what you even can do if you're an individual or a mama going through this experience?
So breaking the stigma, I think it's important for women to talk about the realities of postpartum in general. Not only are you mentally drained and mentally dealing with lots of hormone changes, you're also physically dealing with a lot, which I didn't know how sore I was going to be. I didn't know the amount of bleeding that was going to take place. I didn't understand how much incontinence I was going to have. which, peeing on myself.
Still have that 3 kids
Yeah.
later.
Yeah. And you're just so unaware of how unlike yourself you're going to become. And so with all of that, I think that it's important for women to continue to talk about that. It is normal to experience all of that together. And I'm kind of like, don't be afraid to share that you're sad. Don't be afraid to share that you're feeling anxious. Don't be afraid to share those scary thoughts that you're having. That has been something that I've been doing, just telling people I've had those thoughts. That is a red flag. You should see someone about that. That is important to know that that's also not normal to have that. That's something that we have to take care of, because a lot of people are like, oh, that's normal, that's normal, that's normal. And then all of a sudden you're like, but I'm actually mentally ill now. So is this normal? And
where's the line?
Yes,
right,
there's a line.
exactly.
Yeah. And we tell women so much, like, that's normal. That's normal. That's like, you hear that so much that you feel like you're doubting
crazy.
You're crazy. You feel crazy. Like nobody believes you. Okay, well then maybe I am. This is normal and I just won't tell anybody anymore.
Right. And then you're like, well, this is my new normal. This is not fun at all. Like, motherhood sucks.
Yeah, right?
No, which
not what I
motherhood
thought
has been
it'd
the
be.
best thing ever.
Yeah.
Yeah.
So,
Instagram lied to me.
Yeah, exactly.
Oh my gosh.
Yeah. Sharing story and advocating, I definitely agree with you on that. And then I would say I've seen a couple of clients who have had similar stories to you, Gabby, and having that support system. We can't do this alone. We were never meant
supposed to
do it
No.
alone. And that is what saved you, Gabby, is your husband advocating for you, finding quality, educated people who listened to you and met you where you were and got you the proper meds, got you the proper support. And that's why you're here.
Yeah.
Right.
And baby boy number 2. Well, first boy, second baby.
Yeah.
Right?
Yeah. It's,
and your
at
neighbor.
the time, it's a big thing to take on by yourself. And I think that with my first, I thought I had to do everything alone. I'm breastfeeding. Like, what?
Yeah.
You should just know mother's intuition, Gabby. Figure it out.
Yeah,
I know. That's
exactly.
So stupid.
That's
And
what you're
I'm
doing.
like, I don't know what I'm doing. I don't have anyone. And my mom didn't know that she should step in to help me, because this is obviously her first grandchild. And she didn't know where to draw the line, because I'd been so independent for so long. So she was like, does she need me? Does she not need me? So this time around, I also had my mother stay for a month, not in my house, but she rented a house near me, because I needed that support.
Yeah.
And last time I kind of was like, I'm fine. And then I wasn't. So having that village, people talk about it, but are you doing it? Because that's the most important. Having people that you can trust, people who can check in on you. Are you okay? How are you feeling today? If it's been 2 weeks and you're crying every single night, every single day, if it's past 2 weeks, you need to see someone about that. That is not normal. It's normal to cry and go through emotions, but sadness longer than 2 weeks after postpartum is beyond baby blues. You should talk to someone about that. There's just so much that having people to check in on you is huge. What you need, I think,
and sleep. You need sleep.
Yeah, so much sleep.
Yeah. You said that earlier, that this time you guys are making sure you're hitting those 4 to 5 hours. So you've probably set up a care plan to split the nights with your husband. And
exactly. I've been pumping. So he's been doing bottle feeding at night. Not so much now, because breastfeeding actually makes me more tired, and pumping just didn't work for me. I didn't like it as much at night, but I breastfeed and then I hand the baby to him. He burps and then he puts him back down, however long it takes, and I sleep. And that's not every night, of course, because he needs sleep too, but even every other night is going to make a big difference.
Yeah,
it does. 100%.
Yeah. You are amazing, and we are so thankful that you are courageous and brave to share your story, because it's very hard for people to talk about it. And we all feel judged, I think, and that's hard. But you are amazing, and we're so thankful that you came on today to talk to us.
And we're
Thank
so
you for
thankful that
having
you're
me.
here.
Thank
Yeah,
you
we're
Yeah.
so
happy
much.
that you're here.
Me
Yes.
too. I'm so happy I'm here because
Mhm.
there's just so much joy in my life now, and I can't
Yeah.
imagine if I wouldn't have taken that phone call and we
Mhm.
wouldn't have gone to the ER. I mean,
Yeah.
because it just would have gotten worse, I think. So,
Yeah. Yeah.
so
Well,
I'm
thank
happy.
you so much, Gabby, for coming. We really appreciate you sharing your story and being an advocate in this space for other women. And this story will touch other people, whether it just gives them education around pregnant people in their life or to come up with a strategy if they are pregnant to avoid and soften that postpartum when it's time.
Yes.
Absolutely. And thank you so much for having me. And just one more thing, for those people who don't have a very supportive husband, or even they're a single mother, you're not alone, and there's friends, there's people you can reach out to, there's support groups to help you with that. Because thankfully I did have a supportive husband, and I'm thankful for that, but I know a lot of people don't, and
Yeah.
I feel for them, and I always reach out to help no matter what. Find those
Yeah.
resources for you.
Because they do exist.
They do.
Yes,
They do.
they
They
do.
do.
Yeah.
Yeah.
Well, thank you so much for joining us today, Constance and Gabby on Snoozeworthy. We will see you next time. Sleep well.
Bye.
Bye.
Well, thank you, Gabby. We appreciate